Hey guys, it's Dr. Hub. Today we're looking at the rotator cuff muscles and the important test and the signs. The first one is the empty can sign. So empty can sign, the muscle which is tested is the supraspinatus. Then we look at the resisted external rotation. So this is associated with the infraspinatus. Then moving on to the lift-off test or the belly press test. So there is lift-off test as well as the belly press. So lift-off test or the belly press test. This is the muscle tested is the subscapularis. Next is the abduction paradox. Subduction paradox and the drop arm sign. Drop arm sign. So the abduction paradox and the drop arm sign. So this is nothing but the muscle tested is seen in the complete rupture of the rotator cuff. So it is seen in complete rupture of the rotator cuff. Then we move on to the lag sign. The lag sign is associated with seen in the tear of the supraspinatus or the infraspinatus. So it is nothing but a tear in the supraspinatus as well as the infraspinatus. Now let's look at the drop sign. So lag sign was a tear in the supraspinatus or the infraspinatus. Now looking at the drop sign. The drop sign is seen in the tear in the infraspinatus. So it is nothing but a tear and it is in the infraspinatus. And the posterior part of the rotator cuff. And the posterior part, this is of the rotator cuff. To learn and grow daily like this, please do subscribe.